Welcome to the Deep Dive. Today we're going to be exploring some excerpts from the Handbook of Personology and Psychopathology.
Really interesting stuff.
Yeah, and get ready to uncover some surprising connections between personality and psychopathology.
And evolution.
And evolution. We're talking about what makes us tick on like a really deep level here.
Absolutely. We'll be pulling insights from this handbook, looking at things like personality disorders,
Okay.
assessment methods, treatment approaches, and even some evolutionary theory.
Oh, wow. Okay, I'm already intrigued. One thing that really caught my eye was this idea of evolvability. And it seems to be kind of a challenge to like traditional evolutionary thinking. Yeah, I always thought, evolution was all about survival of the fittest, passing down like the best genes. How does this evolvability thing kind of shake that up?
Well, it suggests that organisms might have actually evolved mechanisms that encourage genetic mutations.
Yeah.
And it's not just to weed out the weak, but to adapt continually.
So it's not about like staying the same, but about having the capacity to change.
Yeah.
That's a huge shift in perspective.
It is.
I wonder what this means for us humans. Are we constantly evolving even now?
It's a fascinating question. And the handbook actually mentions artificial life. Research is being used to study this. They're using computer programs that can actually evolve.
Wait, so scientists are creating like virtual worlds where computer programs are mutating and adapting? That sounds like something straight out of a sci-fi movie.
It does, doesn't it?
Yeah.
And what's even more mind-blowing is they've developed these genetic algorithms, which are these computer programs that can evolve solutions to problems. And it's even led to some patentable inventions by computers.
Computers inventing things. Now, that's something I'd like to dive deeper into. But let's bring it back to like human personality for a sec. How do genetics factor into who we are?
Well, the handbook highlights kind of two main approaches to this.
Okay.
The first one is behavioral genetics, which explores how much of a trait is heritable. You've probably heard of twin studies.
Right. Those are always fascinating.
Yeah, so that would be an example of that approach.
Okay, so what's the other approach?
So the other approach is called the molecular approach. And this one seeks to identify specific genes that are linked to personality traits. And there's even an emerging field called molecular genomics that's aiming to pinpoint those DNA sequences that make us unique.
So imagine having like a map of the genes that contribute to your personality. That's pretty amazing.
Yeah, it's pretty incredible.
How would that change our current understanding of personality theory?
Well, right now, personality theory relies heavily on statistical analysis, grouping people based on questionnaires.
Right.
But with molecular genomics, we might be able to define personality domains based on shared genetic roots.
Oh.
It could even settle those long-standing debates about which traits belong together,
So instead of relying on statistics, we might look at shared genes.
Exactly.
That's a really concrete way of understanding those building blocks of personality.
It is.
But what about the environment? How does that fit in?
That's a crucial point. And the handbook tackles this head-on when discussing personality disorders. They present evidence for both genetics and environment being key players.
So the classic nature versus nurture debate continues.
It does, but this handbook really emphasizes the interplay between the two. And they introduce this concept called the stress diathesis model,
Okay.
which basically proposes that we inherit vulnerabilities for certain disorders, but they only manifest under specific environmental stressors.
I need an example to really grasp this.
Okay, sure. So take borderline personality disorder. Studies show that childhood adversity is a very common risk factor.
Right.
But most people who experience adversity, don't actually develop the disorder.
So why do some people develop the disorder while others don't?
Well, that's the million-dollar question. The stress diathesis model would suggest that some individuals might inherit a sensitivity to those experiences that make them more impactful.
That makes a lot of sense. So it's not just about the experience itself, but about how our individual predispositions interact with it.
Right.
It's a combination of nature and nurture.
Precisely. And there's even some speculation that the rapid changes in our modern society might be interacting with predisposed personality traits, leading to things like increases in disorders like narcissism.
Ooh, that's a scary thought.
It is.
Yeah, but it makes you wonder, is our environment pushing certain buttons that were manageable in a slower, more traditional society?
It's definitely a possibility worth considering. And the handbook also delves into the concept of identity diffusion, which is a core aspect of severe personality disorders.
Can you elaborate on what identity diffusion actually means?
Sure. Essentially, it's a lack of integration of the concept of self and of significant others. And this leads to a kind of fragmented sense of who you are and how you relate to the people around you.
That sounds incredibly
Yeah,
unsettling.
see, it can be. The handbook notes that this is most prominent in borderline personality disorder.
Okay.
And this can lead to unstable relationships and difficulty understanding oneself and others.
So there's a struggle with both personal identity
Yeah.
and in me understanding the people around you.
Right.
How does that contrast with something like narcissistic personality disorder?
Well, with narcissistic personality disorder, there's often a very strong, albeit unhealthy, sense of self,
Okay.
but a profound inability to grasp the personalities of others.
So in one case, the self is fragmented, and the other, it's like overblown, but at the expense of understanding others.
Yeah, that's a good way to put it.
So how do we even begin to categorize and diagnose these complex experiences?
Well, the handbook goes into the structure of the Diagnostic and Statistical Manual of Mental Disorders, or the DSM, as a tool for diagnosis.
The DSM. Isn't that just like a list of disorders?
It's more than just a list. There's a hierarchy involved.
Okay.
It moves from like these broad categories like anxiety disorders to specific disorders like generalized anxiety disorder and even subtypes within those disorders.
So it's like a system for organizing and classifying mental health conditions.
Exactly. And they're actually moving away from these rigid checklists towards a prototype categorization approach.
Okay.
So instead of needing every single symptom, it looks for patterns of characteristics.
So a more flexible approach.
Yes.
Does this solve the problem of trying to fit complex human experiences into neat categories?
It helps, but even prototypes have limitations.
Yeah, I can see that.
The DSM still forces a yes-no categorization onto things that really exist on a spectrum.
Right, right. Speaking of categorization, the handbook also delves into Freudian psychoanalysis.
Yes.
Specifically Freudian slips.
Yes, those seemingly accidental speech errors that supposedly reveal our unconscious thoughts.
Right.
Very fascinating and controversial area.
Yeah, are Freudian slips really caused by repressed desires, or are they just coincidences?
Well, that's a question that has been debated for years. The handbook does mention a study where researchers found that people with obsessive-compulsive disorder, a condition that Freud linked to certain unconscious desires, actually made more slips when talking about sensitive topics.
So maybe there's something to it after all. But what I'm really curious about is this shift the handbook mentions, moving away from viewing personality disorders as like fixed categories.
Yes. They're highlighting a growing emphasis on understanding the interpersonal patterns at play.
So instead of labeling someone as, disordered, we look at how they interact with others.
Exactly.
That seems more helpful and more focused on behavior.
Right. It's more practical and nuanced.
Yeah.
It allows for a continuum between healthy and disordered functioning. They call this the interpersonal nexus.
Interpersonal nexus. That sounds intense.
It's actually pretty straightforward. It emphasizes relational patterns, how we interact with others, as being a core element in both personality development and potential problems.
So our relationships shape who we are, both for better and for worse.
Precisely. And it's not just external behavior. Our internal world also matters. They discuss internal representations, which are mental images of ourselves and others that can influence how we perceive and interact with people.
It's like we have these internal blueprints that guide our relationships.
Yeah, that's a good way to put it.
But can you connect this idea of the interpersonal nexus to something like politics? Do our personality patterns affect our political views?
Well, the handbook actually makes that connection.
Really?
Yeah, they introduce Millon's evolutionary model, which links normal personality styles to more pathological patterns on a continuum.
So those basic tendencies that make us who we are might also shape our political leanings.
It's a possibility.
That's fascinating. Tell me more about that.
Okay, well, Millon identifies 3 universal polarities
Okay.
that kind of drive these personality styles. A pleasure-pain, active-passive, and self-other.
Okay.
And these polarities kind of combine to create distinct personality styles.
Yeah, I'm already starting to see how those combinations could play out in different ways.
Right.
Give me an example of how this applies to, like, real-world figures.
Well, they actually analyze Bill Clinton
Oh, wow.
as potentially having a narcissistic personality style with outgoing features.
So they're applying these frameworks to understand real-world political figures. That's really interesting. But how do those polarities translate into, like, specific political views?
Well, they suggest that the polarities might even be connected to ideologies like liberalism and conservatism.
Okay.
For example, someone highly sensitive to pain and focused on self-preservation might lean towards conservative viewpoints.
And someone more driven by pleasure-seeking and change might lean towards liberal ideas.
Exactly.
So our political views could be partly rooted in our evolved personality styles.
Wow, we've covered a lot of ground already.
We have. But there's still much more to explore in this Handbook of Personology and Psychopathology. Stay tuned for part 2, where we'll continue our dive into this fascinating world of personality and its many dimensions. Sounds good. I can't wait. Welcome back to our deep dive into the Handbook of Personology and Psychopathology. Before we move on, I wanted to touch on something we discussed earlier, the DSM, and how it's used to diagnose personality disorders. It's such a complex process trying to categorize something as fluid as human experience.
Oh, absolutely. And as we mentioned, the DSM has shifted towards a more flexible approach called prototype categorization.
Okay.
Instead of these rigid checklists, they use sets of typical features to define a disorder.
So it's not about checking off every single symptom, but rather looking for an overall pattern.
Right.
I remember you mentioned that they use borderline personality disorder as an example of this prototype approach.
Yes.
What are some of the key features they highlight for that disorder?
Well, some of the central features include a fear of abandonment, difficulty controlling anger, unstable relationships, and a really shaky sense of identity.
Yeah.
Really paints a vivid picture of the challenges someone with this disorder might face.
It does. And those features connect back to that idea of identity diffusion we talked about earlier.
Exactly.
But even with this more flexible prototype approach, the DSM still has limitations.
Right. It does. As we discussed, even prototypes still force us to categorize experiences that might be more accurately represented on a spectrum.
Okay.
And actually, the handbook uses the concept of psychopathy to illustrate this challenge.
That's interesting. I've always been fascinated by the idea of psychopathy, but it seems like such a loaded term.
It is a loaded term.
How does the handbook approach it?
Well, they delve into how the term psychopathy has been used and often confused with antisocial personality disorder, which is in the DSM.
That's true.
However, they argue that psychopathy, as it's traditionally understood, doesn't perfectly fit into the DSM criteria.
So what's the key difference between the two? I'm assuming there's more to it than just criminal behavior.
Right. While antisocial personality disorder focuses mainly on disregard for social norms and rules, psychopathy includes those aspects, but really emphasizes specific personality traits.
Okay, like what kind of traits?
Traits like superficial charm, a lack of empathy and remorse, manipulativeness, impulsivity, and a grandiose sense of self-worth.
So it's not just about breaking the rules. It's about having a certain personality style that predisposes someone to those behaviors.
Right.
How do they even measure something like that?
Well, they discuss different measurement tools, specifically the PCLR, or the Psychopathy Checklist Revised.
Okay.
It's considered like the gold standard for assessing psychopathy.
So checklists for psychopaths, how does that work?
Well, it's a semi-structured interview that assesses 20 different traits, each scored on a scale.
Okay.
And what's really important here is that it goes beyond simply looking at criminal history.
Right.
It aims to understand the underlying personality structure.
That makes sense. But is there even agreement on whether psychopathy is a distinct category or just an extreme end of a personality dimension?
That's one of the debates they delve into. They present research using methods called taxometrics that try to determine if there's a natural grouping underlying a concept.
Right.
And there's evidence to suggest that a distinct group of people might fit the psychopathy profile, especially with regard to chronic antisocial behavior.
So it lends some credence to that idea of like a born criminal.
Potentially.
But are all psychopaths the same?
Not necessarily. The handbook discusses this idea of different subtypes of psychopathy, like primary and secondary psychopaths.
Oh, that's really interesting. What's the difference between those subtypes?
So primary psychopaths are often characterized by this lack of anxiety and remorse, a manipulative style, and a callous disregard for others.
Right. I can picture that type. What about secondary psychopaths?
Secondary psychopaths might share some of those traits, but they experience more anxiety, guilt, and emotional reactivity. Their actions might stem from impulsivity or a need to cope with difficult emotions.
So different motivations and internal experiences. The handbook even explores evolutionary theories to try to explain these subtypes right. What do those theories suggest?
Well, one theory proposes that primary psychopathy might be a product of something called frequency-dependent selection,
Okay.
meaning a small number of individuals with those traits might have an advantage in certain social contexts.
How could being a psychopath be advantageous? It seems kind of counterintuitive.
Well, think about it from a purely evolutionary standpoint.
Okay.
Being skilled at manipulation could lead to acquiring resources or mates more easily.
I see what you mean, but at a significant cost to others.
Exactly. It's a controversial theory, and it certainly doesn't make those behaviors ethical.
Right.
But it does make you think about the origins of these personality styles.
It does. And speaking of different personality styles, I was fascinated by the section on measuring normal personality,
Yes.
particularly using Mellon's theories.
Yeah.
It seems like a very different approach compared to diagnosing disorders.
Absolutely. Millon's approach moves beyond just focusing on pathology. It aims to understand the full spectrum of personality from healthy to unhealthy.
So instead of just looking at the dark side, we're looking at the whole landscape of personality.
Exactly. And they discuss specific instruments that Millon developed to measure this, like the MCMI and MIPS.
Okay.
These are questionnaires that people can take to understand their own personality styles.
So these assessments are based on Millon's evolutionary model, which we discussed earlier.
That's right.
The one with the 3 polarities: pleasure-pain, active-passive, and self-other.
Exactly. Those polarities form the foundation for these assessments,
Okay.
but they also address the challenges of measuring personality,
Okay.
particularly when translating these instruments into different languages and cultures.
That makes sense. Words and concepts can have different meanings across cultures, which could affect how people respond to questionnaires.
Absolutely. And the handbook dives into the process of adapting these inventories for different countries, highlighting the need for cultural expertise, not just language translation.
So ensuring that the underlying concepts are understood the same way across cultures.
Yes.
It's interesting to see the meticulous work that goes into making these assessments accurate and reliable.
It is.
But measuring personality is only one part of the equation.
Right.
What about using this knowledge to actually help people, particularly those struggling with personality disorders?
That's a crucial point. And the handbook doesn't shy away from discussing treatment, covering a range of approaches from traditional therapies like psychodynamic and cognitive behavioral to newer therapies like schema therapy.
So like a buffet of therapeutic options.
Hmm.
What's fascinating is they highlight a shift in how we think about treating these disorders right. Can you tell me more about that?
Yeah, there's a growing recognition that personality disorders are often rooted in problematic interpersonal patterns, connecting back to that interpersonal nexus concept.
So the focus is shifting from fixing something broken within the individual to helping them develop healthier ways of relating to others.
Precisely. And that insight has led to therapies that specifically target those interpersonal patterns.
That makes a lot of sense.
Yeah.
Do you have any examples of what these therapies look like in practice?
Sure. One example is interpersonal reconstructive therapy, or IRT.
Okay.
And it's based on the idea that our current relationship patterns are shaped by our early experiences with significant others.
So it's about understanding how those early relationships might be influencing current interactions.
Right.
Almost like untangling those internal blueprints we talked about.
Exactly. The therapist helps bring those patterns into awareness and guides the patient towards healthier, more adaptive ways of relating.
It sounds like learning to rewrite those old blueprints.
Yeah, it is.
What other therapies focus on interpersonal dynamics?
Well, schema therapy is another good example.
Okay.
It suggests that we develop these core beliefs or schemas
Okay.
about ourselves and the world based on early experiences.
Right.
And these schemas can become maladaptive and lead to problematic relationship patterns.
Like those negative self-beliefs we sometimes carry. I'm not good enough, or I'll always be abandoned.
Exactly. So schema therapy helps patients identify and challenge those schemas
Right.
and develop healthier ways of thinking about themselves and their relationships.
So it's about rewiring those negative thought patterns.
You could say that. They also mention specific techniques used in schema therapy.
Oh, cool.
Like imagery rescripting, where the patient revisits a painful memory but creates a more empowering ending, and chair work, which involves dialogue between different parts of the self to work through internal conflicts.
Those techniques sound incredibly powerful.
They can be.
It's amazing how therapy can help us access those deep-seated patterns and create real change.
It is.
But it's not all about therapy, right?
Right.
The handbook also discusses how personality influences physical health.
Yes, they discuss research linking traits like optimism and conscientiousness with better health outcomes.
Okay.
Conversely, traits like pessimism and neuroticism can actually increase the risk of health problems.
So personality isn't just about mental and emotional well-being. It affects our physical health, too.
It does. They delve into the mechanisms at play, like how conscientious individuals might engage in healthier behaviors.
Right.
Conversely, someone more neurotic might turn to unhealthy coping mechanisms like smoking or excessive drinking.
So our personality can shape our lifestyle choices, which directly impact our health.
Exactly. But they go deeper, discussing how personality impacts our physiological response to stress.
Hmm.
Remember how we talked about how our beliefs can make us more or less resilient?
Yes, those internal blueprints.
Well, certain personality traits can actually affect our immune system and hormonal responses to stress,
Yeah.
making us more or less vulnerable to illness.
Wow, so personality can actually affect our body's ability to fight off disease.
It can.
That's pretty incredible.
It is. And they point out that understanding these connections can help healthcare providers tailor their approach and better support patients.
It seems like we're only beginning to understand the profound impact personality has on every aspect of our lives.
We are. And the exploration continues in the Handbook of Personology and Psychopathology. Join us for part 3, where we'll delve deeper into the biological underpinnings of personality and how our personalities impact our interactions with the healthcare system.
Welcome back to the deep dive. We're wrapping up our exploration of the Handbook of Personology and Psychopathology, and I'm still reeling from that last segment, personality affecting our physical health. That's wild. But there's so much more to unpack, I think, before we jump into new territory. I'm curious about something we touched on earlier, the biological side of personality.
It's a fascinating area. The handbook really dives into this interplay between our biological makeup and our psychological experiences, kind of revisits that age-old nature versus nurture debate.
Right, that debate never seems to go away. What new insights are emerging from fields like genetics and neuroscience?
Well, they discuss research on temperament, those inborn predispositions that we have to certain emotional and behavioral patterns. Think of it as our baseline emotional style.
So we come into the world pre-wired with certain tendencies, and then those tendencies are shaped by our experiences over time.
That's the idea. Yeah, they suggest that temperament is heavily influenced by genetics and kind of sets the stage for later personality development.
Okay.
So different temperamental styles interact with the environment, leading to diverse outcomes.
Can you give me an example of how that might play out in real life?
Sure. Imagine a child born with a highly sensitive temperament. Now, in a supportive and nurturing environment, they might blossom into a compassionate, empathetic adult. But if that same child faces a lot of early adversity, well, they might be more vulnerable to things like anxiety or depression later in life.
It really highlights how crucial that interplay between nature and nurture is. The handbook also links this to personality disorders, right?
Yes, they delve into specific biological factors that might be at work in these disorders, like differences in brain structure and function, neurotransmitter activity, and even hormones. It's a reminder that our mental experiences have a physical basis in the brain.
So are we starting to understand personality through a biological lens, seeing how our brains shape who we are?
Exactly, and they talk about how this perspective is informing treatment approaches. For example, with borderline personality disorder, which we discussed earlier, there's evidence suggesting differences in brain areas that regulate emotions.
That makes sense, considering those intense emotional experiences are a hallmark of the disorder. Does this biological understanding translate into specific treatment options?
It does. Some medications like mood stabilizers can help regulate emotions, and therapies like dialectical behavior therapy or DBT teach skills for managing emotional distress and improving relationships.
So it's not just about talking through problems, it's about addressing the biological side as well.
It's about integrating both approaches.
Okay.
They point out that this integrated approach combining therapy and medication is becoming more common in treating personality disorders.
I see the value in that, acknowledging both the mental and physical aspects of these conditions. But it's not just about treating disorders, is it? I remember you mentioned that the handbook even explores how personality influences our interactions with the healthcare system in general.
Absolutely. They explore how personality traits can affect how we approach our own health, including how we interact with doctors and treatment plans.
I wouldn't have thought personality would play a role in something like that. Can you elaborate on what they found?
Sure. For example, someone with a trusting, agreeable personality might be more inclined to follow their doctor's recommendations and adhere to treatment plans.
That makes sense. They're more likely to trust the expert's advice. What about people with different personality styles?
Well, someone more skeptical or distrustful might be more likely to question their doctor's advice or even refuse treatment.
So personality can act as a filter for how we process and respond to medical information.
Right.
It seems like that could have a huge impact on health outcomes.
Exactly. And they emphasize that healthcare providers need to understand these dynamics to communicate more effectively and improve patient care. It's not just about giving instructions, it's about tailoring the approach to the individual's personality.
That makes a lot of sense.
Yeah.
It highlights how important it is for healthcare providers to see the whole person, not just the symptoms. It's
Right.
not just about treating a disease, but treating a person living with that disease.
Precisely. And the handbook takes it even further by exploring the broader societal and cultural influences on personality, recognizing that we don't develop in a vacuum.
That's interesting. What kind of influences do they focus on?
Well, they discuss how cultural norms and values can shape personality development.
Okay.
For instance, some cultures might prize independence and assertiveness, while others might emphasize harmony and collectivism.
Right.
So the same underlying personality tendencies might manifest differently in various cultural contexts.
That's a really important point. What might be considered normal in one culture could be viewed differently in another.
Exactly. And they talk about how these variations can affect how we understand personality disorders. What might be seen as problematic in one culture could be perfectly acceptable in another.
It's a reminder to be mindful of cultural context when thinking about personality. Are there other societal factors that come into play?
Yes. They also discuss things like socioeconomic status, access to education, and exposure to violence or trauma as factors that can shape personality and affect the prevalence of personality disorders. It's about recognizing that our environment, our social context, plays a huge role in who we become.
It's like we're zooming out and seeing the bigger picture, how our individual personalities are shaped by these larger forces.
Exactly. And they argue that understanding these influences is critical for developing effective prevention and intervention strategies. It's not just about treating individuals, it's about creating healthier environments that support positive personality development.
That's a powerful message that we can have a role in shaping not just our own personalities, but also the personalities of future generations.
It is, and I think one of the most valuable takeaways from the handbook is this emphasis on an integrative approach to understanding personality. It's not just nature or nurture biology or psychology, individual or society. It's all of these things working together.
I've definitely noticed that theme throughout our deep dive. That holistic perspective is really important.
It is, and they highlight the value of different theoretical perspectives like psychodynamic theory, cognitive behavioral theory, and evolutionary psychology as all offering unique insights. It's about embracing the complexity of the human experience and using all the tools at our disposal to understand it better.
That's a great way to put it.
Yeah.
This deep dive has definitely opened my eyes to the multifaceted nature of personality. It's so much more than just a set of traits. It's a dynamic force that shapes our lives in really profound ways.
It is, and we've only just scratched the surface.
Yeah.
The handbook is a treasure trove of insights and perspectives that are sure to spark curiosity and deeper exploration.
Well, I know I'm definitely adding this to my reading list. This has been such a fascinating journey, and I feel like I have a whole new understanding of what makes people tick. Thank you for guiding us through this deep dive.
It's been my pleasure. And remember, fellow deep divers' personality is an ever-evolving field, and there's always more to learn and discover. Keep questioning, keep exploring, and keep diving deep.
Until next time.